Most people know about multiple sclerosis. It's a disease that affects the brain and the spinal cord. It's an autoimmune disease, and it usually affects adults. But most people don't know that can also affect children. My name is Dr. Rachel Zolno, and I'm a pediatric neuroimmunologist who specializes in pediatric multiple sclerosis. Most pediatric patients with multiple sclerosis are in their teenage years, but rarely we do have children who are less than 10 years old who can also come in with multiple sclerosis. So a lot of the presenting symptoms might be similar to what you would see in an adult who presents with multiple sclerosis, but unfortunately we know that children who have this disease actually often present with a greater severity of disease at the onset. So they might have more of what we call lesions in their brain and their spinal cord. But what we also know is that children in general are very resilient. And so kids with multiple sclerosis luckily do really well with the treatments that we have and oftentimes recover much sooner than adults. Pediatric patients with multiple sclerosis who come to Mount Sinai are able to come to the Multiple Sclerosis Center at Mount Sinai, where we treat both adult and pediatric patients. Our center is really wonderful because we have multidisciplinary care, where our patients with MS are able to see neuropsychologists, social workers right there on site. We also have a whole team that works together to provide the really specific treatment that we have for multiple sclerosis. A lot of our patients need infusions as treatments, and we have an infusion center that we work with. And then at Mount Sinai, there are also other specialists who your child would see, including neuroradiologists and ophthalmologists, and we all work together as a team here to really provide the best care for our patients. In addition to multiple sclerosis, I also take care of children who have disorders that look like and mimic multiple sclerosis. So some of these disorders are caused by specific antibodies. MOGAD is one of the names for the disorders. Another one is called NMO spectrum disorder. And disorders like MOGAD are actually quite common in children. And so I take care of these patients as well at the MS Center. The whole landscape of MS has actually really changed for the better over the past 10 years or so. So we have treatments available to us now that are excellent that they didn't have 10, 20 years ago. So the expectation that I have for my patients moving forward is really different than if they had been diagnosed in the past. So with these new treatments that we have, our patients do really well. Many of them, once they start, go on and don't have any symptoms going forward. So they may have to be on treatment for the majority of their life and may have to have check-ins, but outside of that, they come to see me and tell me about their college plans, the sports that they're playing, and are really living these normal lives that they always thought they were going to have.